really bad problem. We have now far surpassed that in the number of cases. Now, I will say, let's be honest with ourselves. Part of the issue is we do have a little bit better testing, but it's not due to that. It's due to a different, maybe a wrong understanding about reopening. Now, what I want to compare to, look at Europe, okay?
Karen, can you do me a favor? Can you try to enlarge that? Is it?
I don't know exactly. I mean, I'm already on a full screen. You know, I just don't know what to do.
I feel like I've seen it bigger. Okay, fine.
Yeah, because I have a sort of a small thing myself.
Perfect.
But
fine.
If we look at Europe, now look at Europe, you can see that the peak, I mean, it couldn't even get on the graph, right? And now Europe has started from far, far more cases than us, and it's going down. Now, again, this is not normalized to population, so we definitely want to look at that normalized to population, and we definitely want to look at it in the log form because it's so much easier to see everything at once. So when you see, here's the US normalized to population, and now Chile, Brazil, like Brazil is the green line going up, Peru not doing too well itself, but it's improving a little bit, okay? Saudi Arabia is getting a little bit better. But one thing, going back here to just the total numbers, and let me go into the logarithmic form so we can get it all onto one page. This doesn't take into account, this doesn't account for population size, right? So the US is...
This is pure numbers.
This is just raw numbers
Right.
in the log form. But look, the US is trending back upwards. Europe, that had a much worse problem at its peak, is now flattening and going downwards. And we are trending upwards, okay? Very, very unfortunate. As we see Brazil, a country that had a different approach to the virus to start with, is just purely trending upwards. Okay, very, very disappointing. Now,
Can I ask you a question, Karen?
Sure.
In theory, does that mean that we actually haven't peaked yet? Because technically this is still the first wave, right?
Well, let's think about this way. That's right, okay? And in principle, waves are defined. Let's talk about what a definition of a wave is anyhow.
Okay, great.
Normally, you want to see something like this. This is now New York State. So New York State peaked and it's on the way down. Now, when it starts going back up, we're going to see a second peak, and we will call that the second wave. Now, wave comparison is normally to waves in the past, like the influenza in 1918, where there was the first wave, it went down almost to zero. Then it peaked way up in the second wave. We never got down as a country. So calling it, you know, we aren't seeing a wave phenomenon really yet. Now, in retrospect, you know, when it's a year from now and we look back in retrospect, we might call now the start of the second wave, but it's kind of artificial. We never reached a point of low cases. But there's a lot more to this story that we can share now that will help with understanding. Now, as we know, New York doing pretty well, okay? They kind of got their act together. But now look at what we're seeing. Look at all these southern states, North Carolina, South Carolina, even California's doing badly. You know, look at California trending upwards. Florida also sharp turn upwards. Arizona, Georgia. I want to show you, I want to take a look at this one because I've been tracking. I wanted to track to see what might have happened from that indoor rally last week. And again, you know, normally by now, if there were cases, infected people have definitely shared that. and those who are going to get sick, probably the majority of them that rally was 8 days ago, so the majority would be sick by now. And we don't see there's not a sharp uptick, but sort of a gentle uptick. Not a good sign. Oklahoma was holding its own, and I mean, honestly, this is the log scale. This represents a huge increase. Let me just show you in the linear scale. Yeah, the problem with the linear scale, something like New York swamps everything out, right? So New York pushes everything way down. But this is really a sharp jump. But such is life, that's what we're looking at. Now, I want to show you a new site that I think you're going to like to refer to as well. This is called Covidexitstrategy.org. And this is a really helpful kind of a thing, especially for those thinking of travel, want to go somewhere. As you can see, there's kind of like a yellow, green, yellow, and red. So naturally, red isn't great, okay? You probably don't want to be traveling into that. Yellow is making some progress, and green is doing well. Now, as you can see, wow, we've got very little green and almost as little yellow. Okay, it looks like Illinois has shifted. Illinois was green a couple days ago, and now it's shifted into the yellow. So I can see that everything is going red. Things are moving from where they were into the red zone. And you can look at every state. Okay, so this is like the snapshot, okay, from May 28th to June 27th. So way back, okay, we didn't have too much green, but we had a lot of yellow. And now the yellow is shrinking. Illinois was green for a bit, and now it's even popped into, like here it was.
Wow, that is amazing.
Now it's back to red. So these things, you can keep an eye on it. All sad, all very sad. And now this is a nice site. It tells you how they do all the testing. It tells you how they get it. But now this is an interesting thing by day. Let's scroll down to California, because I know we have a lot of Californias. So this is the 14-day trend of COVID. So this is increasing, and we're seeing an 85% increase, okay? Influenza-like illnesses, percent of test target. So some of these places are actually doing pretty good on testing. ICU availability and new cases per million per day. Okay, so you can see that this is the COVID positive rate. This is our positivity rate. We're at 5.9% in California, and it's trending upwards. Okay, so this can kind of give you a snapshot if you're thinking about where you might like to go. Now, as I said before, if you're going this place, this 91 Divock has a place for you to look by, okay, community. All right, so when we go into this, what I put up a few just for the heck of it to be tracking. Los Angeles, 17% growth over the past week. And then remember how we saw 5.6, this is like 5.56, so that's 5.6, that's the death rate increasing. Now let's look, I wanted to look for Tulsa. Let's see if we can see that. Okay, so this, now again, 44% growth rate. That is the kind of thing I would think we might see from a large indoor rally. I was even thinking that Trump might have even got sick himself, but it's been a while, it's been long enough. Someone like him, like chances are a more susceptible person. 50% of people show signs within 5 days of exposure, and many of them within 2 days. And so this is a new site that people might want to track, this COVID exit strategy, to see what the trends are looking like. So Now I'm
So
going to
Karen,
stop.
based on that information, where would you travel?
Nowhere. I'm not traveling now, and I wouldn't travel, and I'll tell you why. I don't have a real need. You know, people have a need, it's a different story. So I've stopped sharing the screen because now I want to go back and tell you why we're seeing what we're seeing and what I think the reasons are. So Kristen put in a statistic that I had read, and you know, there's always a caveat on anything I'm telling you. This is the best of our knowledge as of now, but public health experts are now doing the models backwards. They're now trying to figure out, based on what we know today, the spread rate and so forth. And what we are very, very, very clear about, this is true, it's just the exact multiplicative figure might change. We should have shut down at the end of January. Had we done that, we might have been able, by now we might have almost no cases. The problem is, when we thought there were a handful of cases in New York, the reality was probably about 10,000, possibly even more. And many of them were asymptomatic. Early on, I'm more mad at the Chinese than I was, because as we learned what was withheld, I kind of gave the Chinese credit for sharing the sequence and doing that kind of stuff. But these things are always best nipped in the bud, stopped at the source. And China did stop travel. So they weren't allowing people out, but it was too little too late. Now, what did the Europeans and the Japanese and the Taiwanese do, and the Koreans, what did they do that was smart and we did not do fast enough? They started quarantining all arriving tourists, okay? Like, no matter how you looked, you know, you could have been as healthy as a horse, you were quarantined for 2 weeks. And that, we did nothing of the sort, and we didn't stop travel. We got, on the East Coast, we got a lot of our cases from Europe. That's where they came from. And these many, many people who came into New York and started seeding that early hotspot, they just branched out. They went all over the country. And we also think there are two things we think now that we weren't sure then and we're sure now. One, asymptomatic people do spread. And the estimate is that 60% of spread, between 30 and 60, we don't know the number, but it's likely to be higher rather than lower. These people are giving it to people before they feel any illness whatsoever. And there was a lot of controversy early on. The first papers that were published, and even what China was telling us when they should have known better. And we were also honestly relying too much on SARS, the close cousin of this virus, thinking it can't spread by asymptomatic people. That turned out to be dead wrong. And that influenced thinking way too much. So by the time, now we can say this in retrospect, although we did the right thing at the time, we shut down, it was too little too late. There was no way a 3-month shutdown was going to achieve what we had hoped it would. And that comes back to this positivity thing. We had positivity of, you know, testing positivity rates of 20%. Yeah, we've gotten them way down, but there's a point at which interventions aren't going to work the way you think they are. And when we started our lockdown, it didn't have any hope. Based on the number of cases there already were, the fact that some people just can't stop. Medical people, people delivering food, people working in pharmacies. I mean, a lot of people kept working. People who take care of other people, people who can't afford to stop working or they don't have an income. What Europe has that allowed their people who were sick to stay home more than our people who were sick is a social safety net. You know, like if you were sick, even if you're a nurse or a healthcare professional, you stayed home and you still got paid. We know for a fact in the US, the lower down the totem pole you are, the less likely you are to have any kind of paid sick leave. And we've all read the stories of people going into meatpacking plants with fevers of 101 and even dying because they're not only were their bosses haranguing them to come in, but they also knew they weren't going to get sick leave and they just needed the money. So the tragedy of the US is along several dimensions. Number one, we did not respond fast enough. And it's not that people weren't suggesting things even in January. We should have acted in January. Number two, the social safety net just isn't there. And we've had to borrow a ton of money just to rescue people as best we can. What we're really seeing, it's almost like we put the virus on pause for a little bit. We did help the healthcare system. We don't have a mask shortage. We don't have a glove shortage. We know where the respirators are. So we bought the health system some time to get its act together to manage this. And one wonderful thing that I can say is we have reduced death rates. We're learning simple things. We're looking at pulse ox. We're looking at things to help us assess better when somebody presents whether they're really in trouble or they're going to probably be okay. We didn't know that at the beginning. So there are some positive signs. There are some things that appear to be, working to generally not make this an easy thing, but to prevent death versus just a serious illness. So those are all pluses. But the reality is we're now heading right back to where we were, and we've already exceeded it in many places. So the reality is there's no respite for us now until the vaccine is available. So my personal choice, I'm just continuing to do the things I've been doing. Social distancing as much as possible. Teleworking from home, masking when I go out, and I'm still required to do it. I'm avoiding the 3 C's that we talked about: crowds, congregating, and being close, okay? And that's the best we can do. What people, I think, did wrong or just misinterpreted, and I don't blame them because I was thinking we'd be in a better place now than we actually are. And I'm going to share some important information now that we are going out a little bit more. I thought we'd be better off. We're not. So consequently, nothing has really changed in the situation when the advice to stay at home, social distance, mask wear, nothing has changed. The only thing that's changed is we won't overwhelm the health system because now it's ready. It had 3 months to kind of get organized, plan, get sorted out. So flattening the curve did help in that regard. Now what are we going for? We're going for herd immunity, which we're getting all the time. When states started reopening, and you've already seen that, Florida and Texas, or Arizona and Texas, I think, are already walking some of that stuff back. It wasn't a signal that it's all clear, go back to your normal life, not at all. It was a balance between, well, do we want every small business in the country to go under? And even in my own neighborhood, I saw just yesterday, I was so sad when I saw a really popular French restaurant that was hard to get into. You had to have a reservation sometime in advance. That isn't the kind of place that does takeout. They collapsed completely and they've moved out, and the owners are now just trying to get out. They're trying to sublease their place for the rest of the time they have it. So I'm already seeing businesses I loved that are coming back. And, it's sad. So this is a balance. It's a balance between economic survival and health. And ironically, I'm hearing a lot of people say, even people who've lost their jobs, surveys are reporting that people still want to protect health, even though it means they've lost their job. And, honestly, I don't know how they can be saying that. I've only lost 1/3 of my income, and already I'm very worried about what's going to happen. I've already reduced my expenses to the max. I've already stopped contributing to my retirement and all that. I've already made as much money free as I possibly can, and I still can't, I still can't go without additional income. And, you know, I'm pretty soon all my savings will be gone, right? So I don't know how they're doing that. I don't know how they are saying that, but the reopening is the balance. But what does this mean? Luckily, we have learned more about how to treat it better. The vaccines, we've got 5 promising candidates on the move. You know, we're looking at data all the time. I think the vaccines are going to be on target. I don't know. Here are the questions. Here are the main things we're interested in. What can happen? First of all, does the disease itself engender protective immunity? And the answer is yes, we know that. How long and how good, we don't know. Some diseases engender protective immunity. That's absolutely fantastic, and you don't get the disease again. Some of it engender a bit of immunity so that even if you do get it, it's mild, like the flu does that often. Second, what will the vaccine do? Okay, will the vaccine engender strong immunity such that you get one injection and you're protected either for life or for many years? Will it be mild immunity such that it'll just give you a milder case, like the typhoid vaccine? Doesn't really prevent it, but it prevents you from dying. And last, how long will vaccine-induced immunity last? And we do know vaccines work much better on younger people than older people, all of them, okay? There's less complication and there's more efficacy. So some of the most at-risk people probably won't benefit as much as the least at-risk people. So that's kind of where it stands. It's maybe not the happiest news, but I think we are starting to see, we are seeing that up between 30 and 60% of transmission is from asymptomatic people who are fine. And also the viral titers are very high. That is a real bummer. So the amount, the degree of replication, the amount of virus produced in the nose and the nasopharynx is pretty high. So the aerosols, the sneezing, the droplets, there's a lot of virus, there's a lot of live virus, active virus in there, less than in some other diseases. And now this is like a little bit of a new piece of information. I want to talk about SARS, the first SARS. And I don't know how many people remember that, but that was a gut virus, as many of the coronaviruses are. And there was some pretty lousy plumbing in a building in Hong Kong. And we know that SARS is shed in the feces, as is this virus. We have detected it in feces and wastewater samples all over the place. We don't know if it's live and infectious, or at least I don't know. There might be some papers out there now, but it can be shed in feces. And if it's live in feces, another risky area to think about is a public toilet, because flushing a toilet generates aerosols the same way somebody just sneezes in your face, okay? Now, you don't know who used the toilet right before you. So if you're not careful, and again, it doesn't even have to be your toilet. Somebody infected uses the toilet, flushes the toilet, and now you've got aerosols hanging in the air. You just walk in to wash your hands or, just comb your hair and you can get infected. And we are starting to think there are a number of people that we cannot trace a contact. We don't know, we can't put them in contact with anybody who was sick. And we're starting to think it could have been this bathroom transfer.
Wow.
It could have been live virus in feces that got into the air and caused problems. Now, another thing, we've talked about this before, and I'm re-emphasizing it because this matters. If you want to go to work, if you want to go to school, if you want to go to a restaurant, remember the ventilation. Okay, this ventilation issue. There are known cases. I think somebody even mentioned this one of the weeks we chatted about it, where patrons in one side of the restaurant were infected by patrons on the other side of the restaurant through the air conditioning system. Now, again, unless your ventilation is good, the air con, that was something I feared. Now, the reason I feared it is because, it would negate the heat benefit. We talked a lot about how this virus doesn't love heat, and it's super hot out now. And, guess what? There's no outdoor transmission, right? We're not seeing that. Now, the heat could possibly be helping, or it could just be the dilution effect and the nature of how aerosols move, along, the streamlines when you're in motion, right? So outdoor transmission is minimal, and indoor transmission, when you've got lousy ventilation and you've got air conditioners blowing the aerosols from where they're generated, where the virus is in the air, to who knows where, right? Air conditioning is not the same as having an open window and ventilating. So it's
Karen, in that theory, where does that land us with airplanes? Because in the airplanes,
here's the thing with airplanes. Yeah, actually, that's sort of the thing about airplanes is they do draw in air from outside. They circulate, they bring in air from outside, and they're constantly circulating that. And they're filtering it through HEPA filters, which is one of the best possible things you can do, right? But, and again, if there were not a human being in the plane, let's imagine an empty plane and it's flying. It is drawing air in from outside, HEPA filtering the inside air. HEPA filters clear out the virus. They stick to the filter. You would have a perfectly virus-free cabin. But here's the problem in an airplane. You're sitting beside someone who coughs, who sneezes, who's even just breathing, okay? And if you're nearby, before that air gets sucked into the ventilation, you're gonna be exposed, right? These things, in a plane, you don't feel air currents. It's not that active a filtration process. It's a good filtration process, but you are cooped up. We know the 3 C's: crowding, which is the case in a plane, close, you're very close in a plane, and congregating. Even if you don't want to congregate, you're congregating with the person beside you.
It doesn't have to be in the bathroom in the back of the plane. It's just being
absolutely not.
And it's interesting because this week they came out. The airlines are not. Many of the airlines are not honoring no middle seat person. Mm-hmm. They're saying that they're putting people in the middle seat, and you need to know that heading in, and you can decline your seat, but. So if you're sitting, you're shoulder to shoulder with somebody on the
airplane. And if someone's ill, and again, the bottom line, as we've always said, if nobody in that plane is infected, you can be kissing each other, okay? If no one's infected, nobody's having a problem. If one person is infected, those in the immediate vicinity of that person are at pretty high risk. Because let's face it, and it's also a function of how long is the flight. A 3-hour flight is riskier than a 20-minute flight, and is less risky than a 9-hour flight. Let's just be honest, because
is that from a viral load perspective?
It's both. It's the fact that we know that early viral loads are pretty high. Okay, but you're also being exposed to a high viral load for a longer period of time, and that's the key for this transmission. It's not a one-off casual contact. That I think we're pretty sure about. And we know these things have been spreading through family groups, through friend groups, co-worker groups. That's how it moves. People spend a lot of time together. And we have seen, we've mentioned this before, the fomite transmission, surfaces and clothing and that sort of thing is not as big a deal as we originally thought. It's not impossible. And if a droplet could land somewhere and you touch something, it's not impossible, but it's probably not the major source. And potentially some of these cases that we didn't know about, we couldn't figure out where they got it. It could have been a public bathroom with a toilet flush and aerosolizing live virus. It's a theory, right? But we know for a fact that SARS did spread that way, and we have detected viral products in wastewater. So that's a given. That's not a maybe anymore. Now, remember that ship where the commander got fired for leaking the request for help? Remember that?
Navy ship.
The Navy ship, that Navy ship. Obviously, they tested everybody. And here's the interesting thing. Navy seamen, they're young, right? They tend to be young, largely male, okay, largely, but not anymore. I mean, there's a decent number of women. 1,200 people on that ship were positive for COVID. And they really studied them, 1,200 plus, but between 12 and 1,300 were positive. 60% never got sick. They all have antibodies, and they were tested by not the kit, which they can have errors, but blood draw and looking for them. And only one death, okay? And that death was a 50.
And it was 1,200 out of how many people?
I don't know how many. I don't know, but the Diamond Princess didn't have that many, right? But then again, they didn't test everybody, right? And the Diamond Princess is much older people, right? These tended to be elderly people on cruises. But this is, well, I don't remember the name. Let's see if we can figure that out. I don't remember the name of the ship, but I know that wasn't the commander's name Crozier?
Yeah, that sounds right.
Yeah, Brett Crozier.
So while Karen's looking, just so you guys know, I think most of us are regulars here, but if for some reason you're not a regular, please put any questions that you have in the Q&A. You can find that at the bottom of the Zoom screen. If you are on Facebook, just put it in the comments. I see we've got a comment. We've got a comment from Brian Freitas. He's back. And I know that Emily's put a question up. I've got one question in the Q&A. And the name of the ship, Bev says the name of the ship was Roosevelt.
Okay, let's see if I can find how big is the crew of the Roosevelt?
Thanks, Bev.
I hope that guy gets his job back, but I haven't heard that. Okay, so the ship's company, I don't know how to really read this, how to understand what this means, but okay, 3,200. Because they're breaking it down. The sidearm breaks it down by who's doing what,
Right. I've got a couple of raised hands too here.
Yeah, so honestly, I don't know how many people were on it at the time, but a ton ended up positive for COVID. And many of them never, they've been exposed, they fought it off, they're okay. And I would think these are probably pretty healthy folks. And we only had one death.
But that's still a pretty high percentage if it's 30.
Oh, it's a huge, we know this virus is contagious.
Third of the people had
tomorrow. We know this virus is crazy contagious.
Yeah.
Still not as bad as measles, or they're still worse, but it's crazy contagious. And that two things make it so crazy contagious. One is the high titers, the high viral loads that grow in the nose and nasopharynx early on. And the second is that receptor, the cellular receptor that the viral attachment protein binds onto is very, very plentiful in our body. Mm. Those two are necessary. If it was crazy easy for it to bind to a receptor, but we had fewer of them, we wouldn't have as many cases. So both of these are necessary for that to be the case.
Okay, should we go to some questions? Are we done with the state of the?
I think we're done. That's the update.
The union of the coronavirus.
That's the
on
all the news that's fit
the union. Brian Freitas does think that we should run for office. So hey, stay tuned.
Well, stay tuned, Brian.
I'm wondering, Tara Lee, I'd seen your hand up before. We just put in the chat, do you have a question? I mean, we can bring you guys on live too. And Marge Spindler, your hand is up. Just let me know if that's up for real. Like, do you have a question? And I can always bring, if you guys want to come up live and ask the question, we can do that too. In the meantime, we'll go with.
Oh, so Marge didn't know. She said 5,000 were on the ship. Okay, so
5,000. So
yeah, I couldn't quite figure it out, but nonetheless, that's a ton of people. And
I mean, it's more than 20%, right? It's 24%.
Yeah.
That's 24%, right? If it's
Yeah.
1,200, right?
Yeah.
Is that the correct math? Okay. So let's go first here. And someone emailed me something too. I put in the, Emily, one of our regs. She says, question from our house. What is the current state of antibody testing? She's apologizing if she's addressed recently. I don't think we have talked about that.
Yeah, we,
Good
not
question,
in
Emily.
depth. Generally, it's easier to get the PCR test, but antibody testing, those little kits, like Kristen showed one of those little, you take a blood drop and you put it on, those rapid
have it right
tests.
here.
Yeah, she still has it. They're very variable in terms of quality, okay? Some of them are great and some of them are crap. And the problem is you just don't know which is which. And there was a negative result.
Yeah.
The kind where they take it directly from your arm and they do a more careful test in the laboratory is very accurate, okay? Now,
I'm now still wondering if Adrian was actually positive.
Now, it might be. Now you're going to
continue to
try
read.
again, like when you can get the one out of the, you can get blood drawn
Right.
and do it. Then
Because
you
we
can try
continue to
again.
read the symptoms and sometimes weird, crazy symptoms. I read a story about a young girl who was, talking about the heart rate thing, like how horrible. Adrian, when he was sick, could not sleep for 3 nights because his heart was beating so rapidly.
Yeah, ACE2 receptors in the heart. And now that we know that the virus was there a lot earlier than we thought, hey, he and his friends could have had it. He could have been the vector that started it. And wouldn't that be great? Because now they got a little bit of immunity.
Yeah.
So it's not a definite. I mean, I don't want to make it sound like the kids are total crap, but here's the thing. Adrian, say he did have it and say he had just recovered, then maybe he'd have had a better chance of showing positive. The kids partially depend on how much. And that was one of the first ones available. And the ones that are coming now are better.
Early one,
right?
yeah, for sure.
So as we get better, like everything gets better with time. So the kind
Because
they do
he took that test before Easter. So
yeah, so that was one of the first tests available.
Yeah.
And now there's more companies making them. Yeah, there's a lot that can be said about different testing and antibody testing. That's more to find out if you're protected. Like that's more of a research thing. And it's not the kind of thing like when you're perfectly healthy, you go in and say, can you test me for COVID antibodies? It's like, get out of my face. This isn't a time and place for that, right? So, and it is true. Like, I sort of feel it's very frightening. I mean, Europe is about to bar Americans from travel there. Some countries are going to quarantine all Americans for 2 weeks, no matter how you look. And that makes perfect sense. That is like, here's my thing. Let's learn from those who shut it down.
Yeah.
And those who shut it down made every tourist entering quarantine, regardless of whether you were showing symptoms or you weren't.
Speaking of which, what did New Zealand do? Because they have 0
They
cases.
did that.
Right?
That was one of the things they did. Is tourists coming in were quarantining. They were blocking you from the hot spots at the time. They had ramped up their testing. I mean, it is a smaller country, smaller population density, but the key difference, and even with our our poor haphazard patchwork response, we'd have been way better had we started this 2 months earlier.
Okay, so I'm just looking down here. Okay, I'm gonna go to the question here. Oh, Jean's asking me. Yes, Jean, I will hopefully have the video from you for last week. Yes, it's just gonna take me a little while to do some editing.
Yeah, I've had a couple
I
people
know. Well, it
guess
makes me
people are
feel
watching
good that
them
people are
after.
asking, because
I
it means
never
that people
thought it,
are, it takes, to be honest with you guys, I know it doesn't seem like a lot, maybe, but it takes a lot to sort of set everything up and set up the emails, because it takes time to put the video up on YouTube. It takes me a couple of hours to organize all of it, and sometimes the week just gets by me. And then having to do
an edit.
edit
You
just
know,
is
an
a whole
edit
other thing.
on top.
Emily asked, just maybe this is a follow-up. She's asking about false positives. Are false positives common?
That's false negatives are far, far more common.
Yeah.
But there's false everything, okay? Just not to be misleading. There can be some false positives. PCR is almost, I mean, when you get a false positive, it's usually cross-contamination in the laboratory.
Okay.
That your sample got contaminated with somebody who was positive. PCR is stunningly accurate. But why PCR gets negative is maybe there's no more virus yet in the nasopharynx. PCR is also very, very sensitive. So even if there's very, very little virus, it'll pick it up. But if it's gone from where they're sampling, you're not going to see it.
Maybe I'll make a point of going this week. At Dodger Stadium, you can make an appointment and go for a test, and it's very easy here in Los Angeles.
Oh.
My friend Kama, who sometimes comes on, she went last week, and they actually want people to go for the test positivity perspective, I guess.
Okay, that's cool.
They want people to go.
If they want.
So she said that they give you an instruction that you put it in a bunch of different places. Like, I can't.
Okay, then that's changing. Yeah, that could be they're putting it in a bunch of different places.
She's like down your throat, in your nose, maybe your ear. I can't remember where it was, but like
wherever they're doing it, that's good. Most are still in the nose, and what that will do for you. Maybe you're still asymptomatic and you're about to get sick. You can start staying home.
Okay, I just think we have some comments and questions from Brian Freitz. And I'm glad that he's here, because I thought
Brian has a comment.
Okay,
Such
first
a
of all, I'm
quiet
going to read his
guy.
comment first. On New Zealand, I wish that my friend, who's also a bright line person, a BLEer, Janine was with us today. She's from New Zealand, Auckland. New Zealand also has a woman head of state, which we know, Jacinda.
Yeah, I've heard that the women are on it faster.
Jacinda,
yeah.
I'm spacing her last name, Jacinda. Anyway, has a head calling the shots. Duca Kaczynski 2020. Wicked smart. Yins can't do better.
Well, can we do worse than what's at the helm currently? I mean, it's like,
okay.
I'd say you could take any two random people in the US and they'd probably do a better job. I hate to say it. And I'm really frightened, because I know we've got quality.
I'm sorry. So that's what Brian says. Okay. Number one, unless absolutely necessary. So he's giving a social commentary. We'll hear it. Unless absolutely necessary, stay at home. Socializing isn't a necessity. 2, if you must go out, wear a mask. Your personal comfort / inconvenience doesn't outweigh the health and welfare of other individuals and society as a whole. 3, while out, practice physical distancing. Same deal as wearing a mask. Your personal comfort / inconvenience doesn't trump the well-being of your fellow human beings. 4, every right that the Declaration of Independence, U.S. Constitution, Bill of Rights afford you are balanced. Hold on one second. Balanced by a commensurate responsibility. I like that. Throughout this crisis, no shortage of Americans have groused about their rights being infringed upon. My rights, my rights, my rights, they cry. Where are they? Where are the people asking, what are my responsibilities? And not just themselves. How about folks willing to ask, what are my responsibilities to others? Stay at home, wear a mask, socially distance. Think of your responsibility to others and society as a whole, period. Well, thank you for your.
Yeah, and I'm flipping it like this. I'm saying, like, to the person who says, well, it's my perfect right not to wear a mask. And I say, is it your perfect right to infect and kill someone? Flip it up, and we know that masking protects others more than it protects you, unless you've got an N95, right? So you're protecting your fellow citizens. Like, what I cannot for the life of me understand is how this country reached a point where protecting others from illness isn't something people are spontaneously volunteering to step up for gratefully and without even question. That
They're just not simply interested in it.
Yeah, that it's just like
Not
my desire to be inconvenienced, my desire not to be inconvenienced trumps anybody else's life or health. And, you know, like I said, and what's new in this new wave is it's 20, 30, and 40 something people socializing. Bars are the new super spreading places because look at them. All the 3 C's are violated. There's almost no mask wearing. You're in a crowd. You're close and you're congregating. You're dancing. You're hugging. You're kissing. You're like talking in each other's faces. That's like the perfect storm. And how good is ventilation in most bars? You know,
I've been many a sweaty bar, especially in my 20s and 30s.
Exactly. You know, like I had
the 80s. So yeah, I mean, that's a really interesting conversation around like what our social responsibility is. So thank you, Brian, as always, for bringing up something interesting.
And even the Supreme Court has said, I can't go into a crowded theater and yell fire. I can't do that. I don't have the right to do that. Like rights have limits when public safety comes into play, and that's been adjudicated again and again and again. So I don't know, like I said, I feel like I'm Alice who's gone through the looking glass, and you know, the world I don't understand the world the way I used to.
And I think though, this is my guess, is that we have had a lot of mixed signals, mixed information. You know, it was like, don't wear a mask, it's dangerous. Wear a mask. You know, I mean, I think the numbers speak for themselves, but the truth is, like, I think all of us here in this conversation are interested in looking at the numbers. You know, we're curious about really what's happening, thanks to your leadership, Karen, and coming here to share what your knowledge is. But maybe a lot of other people aren't interested in that. They're just interested in what's convenient for them. You know, we live in I can only speak to the United States, we live in a convenience society. And so people do want to do on some level what is convenient.
Yeah, and there's so much falsehood. And to be fair, as I'm looking back, I'm starting to read, this is even coming out in the popular press now, though maybe people don't, I gravitate towards it because it's about science. But we're starting to look at some of the early problems. And the WHO does definitely have to be looked at in terms of believing China too much. There were a couple of competing groups in Europe where there were contradictory information. And you see, the thing, if we had gotten on this fast, people, first of all, they relied too much on SARS and like SARS as a model. And secondly, in general, it's not, most viruses don't spread before you know you're infected, right? That's not so common. You tend to be at your most infectious just as you're getting sick. So what people were doing in these very early cases, like somebody might have flown and they were jet lagged. So they interpreted like, oh, I was a little tired, I was a little headachy. And they interpreted that to be early COVID, when in reality it wasn't. It was just fatigue from the jet lag. It wasn't COVID illness. And now we've seen it for people who got sick and they didn't travel at all. They just got it from someone who came back from a place. So the early problems is some of the first people seeing this were saying that it didn't transmit before you were ill. And SARS is definitely like that, but not this guy, not SARS-2, not SARS-2. So
Marty has a question. She says, so Karen, you agree that this administration has dismissed all measures to test and prevent this COVID. The lack of strong direction to ask people to wear masks and not gather, especially in arenas. Curious why people are hesitating to wear masks. This psychology is so confusing. I hear tests not accurate, so sad the US is suffering. So that's kind of that piggybacks on this part of the conversation.
Yeah. The reality is contact tracing isn't working. The interviews are too complex and people are lying. They're asking off things I don't even know why they're asking. Why do they care about your sex life? They should just say you were in contact with a person who had COVID and it appears that you had regular contact over a period of 4 days. Quarantine yourself, you're at risk. That's all that can be said with any certainty. Did you catch it? Maybe, maybe not. If you get a test and it's negative, does it mean you didn't catch it? The answer would be, it depends on when the last time you had contact with the infected person was. So there is no guarantee. Like, people want guarantees, they're not there. It's all a question of balancing and just deciding, you know, I'm going back. I found out one of my gyms opened up yesterday. Now they're at a third capacity. It's Orange Theory Fitness. I think you've heard me talk about how much I love Orange Theory Fitness. They're checking fevers. You're working out with a mask on. You've got your own set of equipment. Like in the past, it would be like, I'm on the rower, then somebody else gets on my rower and I get on somebody's treadmill. No more of that. So if I'm number one, I'm on the number one rower, the number one treadmill, and the number one set of dumbbells and stuff, and no one else touches them. And I'm only going for the first class of the day because there will not be aerosols remaining. Overnight, anything, if they got virus in there, it'll be gone overnight. I'm gonna wipe down my equipment before I start. And I masked, so my exposure is minimal, but doesn't mean zero. And it's just because the exercise helps my mental state so much. But let's say going to a bar helped my mental state. I'm not going that far, okay? If I really want to, I'll call up a few friends and maybe we'll go to a restaurant with outdoor seating and have a drink together. If you don't have to do that kind of thing, right? So, and again, young people think they're somewhat invincible, maybe that contributed, but it's definitely we're not seeing older people. They're smart now. It's not spreading among older, it's spreading among the 20, 30 partiers and bar goers. Very clear behaviors are associated with this uptick.
In that, Karen, are they finding that their initial findings are similar to their initial findings, and that these 20 and 30 somethings aren't really getting that sick, or some of them getting sick?
Some are. I mean, the usual, like that is true. And that also is contributing to a lower death rate. You've got younger people getting infected. And generally, if you're not older, you don't have like comorbidities. You know, we have heard this, and it is true, the type A blood group is a little more susceptible to serious. Yeah, that was something that was.
I know about that. I'm AB.
Okay, well, I don't know. It's only A that seems to be showing that, and O's seem to be a little bit protected. Okay, so O's are a little protected, A's are a little more susceptible, but it's not an either or. It's not not total. You know,
everybody's getting it. All blood types are. They're not. No one's
all
like
blood types are getting it.
No access. Okay.
You know,
because I think we've got a couple more questions here on Facebook. I thought I saw another one. Maybe I was wrong. Oh, I thought I saw something here. Oh yeah, and I actually have a question about this too. So Melissa is asking, what about wearing masks in planes?
Sure, and planes are requiring that, by the way. So it's helping. I mean, I believe you won't even get on a plane. The plane itself will give you your mask. That's my understanding. And yeah, that helps. But remember, the kind of masks we're all wearing are only 50% protective, right? And they're mainly about stuff not getting out, you know? Yeah, if you have an N95 mask, you know, and you can wear that on a plane, you'll be safer. If you're going to take your mask off to have a drink or eat something, unwise. Going into a bathroom in a plane, I think would be like, I wouldn't even consider that. If I have to fly, I'm gonna try to figure it out so I wouldn't have to do that, because that's where I'm thinking.
That sounds like a
Just
cesspool.
think about that. Just think about it. If it's shed fecally and you can aerosolize it, look how small they are. Yes, they're sucking air out, but how many different people pass through those, you know?
Yeah, because
I
there's
mean,
like 2 toilets, maybe 3 on a plane, right?
So yeah, I mean, it's like, luckily I don't have any need for flying. And again, everybody's got a different situation. Somebody might just absolutely need to fly. If you can do road trip, you know, it's, you know, you'll be safer. If it's, you know, you can't do an 80-hour road trip maybe, you know, but it's like everybody has to look at their personal tolerance for risk. Look at what would happen. I mean, what would happen if you got COVID halfway on a cross-country road trip and there's only 2 of you in the car and one's a kid? You know, I mean, just think about how do you help yourself? Like, if the worst happened, can you manage it, right? If you're going from family to family on a plane and, you know, if the worst happened, you can just quarantine with your family till you're better. But COVID as a disease, just because you'll get sick within 5 to 14 days, you can stay sick an awfully long time, you know, depending on your status as an infected host. So, yeah, I mean, it's complex and
it's very complex. My neighbor just
I don't judge anybody. Everybody's decision has to be personal.
I agree.
But and I'm just saying, as much as you possibly can, protect yourself in the ways we know to protect ourselves.
So who asked, actually somebody, and I'm sorry, I didn't remember who it was, but someone emailed, I think, about the masks that have the vent on them, where there's a vent. You know what I'm talking about? There's a vent.
Yeah, the N95s have those. There's a filter built right into them.
Filter, yeah. So they were saying that actually is bad because their bad air is going out, and that's not good for people around.
Well, remember what they're designed for. That the better the protection, the less breathable it is. And the idea of N95s is more to protect, like, this is protecting you. The assumption is that you're not infectious. You know, when you're using an N95, you're thinking you're okay. Now, I don't know how they're doing it with health workers. I'm imagining these people are being regularly tested because they know you can be fine and show positive. I imagine they might even have antibody tests for them. I don't know. I'm not one of them. I'm not part of that community. But it would be foolish if it's not going on, because that way you can tell, you know, when someone is shedding. As soon as they start shedding, they're removed from a healthcare situation.
So, but would you say that if you're around someone that has a mask that has a filter on it, does that make you less safe because their aerosol is coming out of their mask?
But that's coming out of the mask no matter what. I mean, whether it's coming out of vent or whether it's coming straight through cloth. Cloth is not hermetic. I mean, so you're breathing that out no matter what.
Got
and
it.
The N95 is capturing some of it internally too. It's not all vented, right? So, you know, and again, what I'm recommending to a lot of people who have, you know, critical jobs, try the face shield. You know, like how they have the plexiglass at stores, that's definitely protecting the cashiers and stuff. Buy one of those little things you can wear, like if you're very worried. Now, the whole concept is with those, again, you're protecting yourself a little more. Once you're infected and you're breathing it out, that's the least of your worries for you. You're already there, right? You're either already infected. Now, again, this is something we haven't really studied yet, but let's say you've got a low viral load, right? And you're not going to have an illness. By wearing a mask, you can actually be concentrating it, and you will be breathing it back in. Absolutely. You might be concentrating the virus in that mask, which is why I say you don't keep wearing the same old mask again and again and again. You're washing them frequently. You're not touching the inside. In theory, if You can wear a fresh mask every time you go out. That's the safest you can possibly be in terms of what if you're starting to get sick and you might not even get to the point of illness, but you've concentrated it in a mask you're wearing again and again and again.
Oh, I'm a total mask offender. I got to work on that.
Yeah, I have lots of.
I need to buy some more masks.
Buy more masks and wash them a lot. And you know what? There's even a video on YouTube. I mean, I think it was the CNN doc. You know, you can fold. You just take a rag, even a dishcloth. You know, take a rag, fold it, bend the edges, and put those hair bands. You know, those elastic hair bands. You just fold the edges, put the hair bands behind your ears, and if it's a mask on the fly from a rag. You know, from an old.
Tara Lee is on right now. I just checked it. She's making masks. I'm like, Tara Lee, I need to order. Like,
yeah, yeah. I made a bunch, but they went so fast. Like I've got.
Okay, Shelly has a question. I'm going to read this. This is what I remember from past Zooms: asymptomatic versus going to get sick, both developing antibodies. Asymptomatic, not spreading so much.
Well, asymptomatic, and now that's coming into question a little bit. They may be a little more than we suspected.
Yeah, that's what it sounded like.
They may have a bigger role. Again, we don't know, you know, but what we always believed, and again, we're still in the early stages and we don't know these asymptomatic. How many were there to begin with? So, and I will try to find the exact numbers from that ship, because that's one of the best experiments we have, because they did test every single person and we're sure. So I'll go back and see if I can get those exact numbers. But the asymptomatic about to get sick are clearly a worse problem than asymptomatic who are going to stay asymptomatic. But the viral loads of the asymptomatic carriers are the ones that are particularly the ones a little older, not the kids. Because remember, 50% of the asymptomatic carriers are younger than 14. Yep. Those who are older than 14 have loads a little higher, at least what we've tested and at least what we think now, but there's still a lot more to learn. But yeah, so both of these categories, what we call pre-symptomatic, there's no doubt that these ones are the main contributor to getting sick. But because they can infect you in their pre-symptomatic, which looks fully asymptomatic phase, they're dangerous. And it's not their fault. They don't know. It's not like when you really are feeling a little sick, but you decide to tough it out. That is now very irresponsible behavior if anybody's doing that.
I'll tell you something. I have done that all of my life, but I think that
who hasn't? But it's a new world. Yeah, we all have done that.
Sick. I remember when I was at Paramount. I mean, I always had a gazillion sick days because it was like I might have called in sick once in a while, but it was never because I was actually sick. I took those mental health days sometimes.
No, me too. I mean, I would be the type, oh, it's a little bit, I mean, I wouldn't go into work dead sick. I mean, but a little on the borderline, just a little not myself. Now that's too.
Those days are over.
Those days are gone.
So let me continue. Shelly has she's a layered question. I have a new situation with COVID. Father's Day COVID spread to a coworker that my husband doesn't interact directly with, who found out daughter got COVID after family gathering last Sunday. Tuesday, the wife got a low fever. Wednesday, coworker stayed home. We just found out today coworker is positive for COVID. So I will be taking measures at home for sure. However, I don't have a basement to put my husband in, but do have a separate bedroom and bathroom. This has been separate for us since March.
Okay, now here's the,
okay. My daughter's first baby is due July 22nd. Either type of COVID, symptomatic or asymptomatic, if I test positive for COVID antibodies, whether I get sick or not, I'm thinking that even someone with antibodies is too much at risk for being around a newborn. I am wanted in at the hospital and at home the first few days. May not happen now. What do you think?
Okay, so the first very important question, have I understood this correctly? this coworker of her husband got sick.
Yeah.
And then that guy, the sick guy, infected his daughter,
Yes.
his own daughter. No, that's exactly what you'd expect. The sick person infects the family because they have close, regular interactions. Now, when was the last time, Shelley, answer this on the chat or wherever you put that. When was the last time?
She just said no. Hold on a second. Shelley, let's just bring you on so then you can ask.
Yeah, bring it on because I'm confused. It's a complex set of questions because.
Okay, I'm bringing her on.
Okay.
Okay, Shelley's on.
Shelley.
Shelley, you're on.
All right. Hello, Karen.
Hey, Shelley.
Yeah, so this is an older guy with his grown children, and there was a Father's Day gathering. And they
so last Sunday then, this gathering took place last Sunday. Okay, got it.
And so they didn't know their youngest daughter afterwards, like Monday, said, Mom, Dad, I'm sick with COVID.
Got it. So she was in the most infectious possible moment when that gathering took place.
Exactly. And so the wife, the coworker's wife had a low-grade fever on Tuesday.
Okay, now let me get it. So let me understand. The daughter probably, well, first of all, we don't know when the daughter gave it to the father, but getting sick within 2 days it happens, right? So let's imagine the daughter gave it to the Father's Day the daughter gave it to the father on a Sunday, let's say. Is that where we're going here?
Well, but the way we're going, the father, the coworker is actually not sick yet. He just tested positive.
Okay.
His wife had the first symptoms of a fever on Tuesday. The daughter showed up Father's Day and then later got sick, I don't know, Monday maybe. I don't know.
Okay, so now that's unclear where the even original source was. Was the daughter visiting her parents frequently? Is this the first time they got together in ages?
It's the first time in ages.
Okay, so chances are that her parents didn't even get the COVID from her.
Oh.
Because if she showed up on Sunday, okay, it's a theoretical possibility. Let's assume, let's run the scenario both ways. Daughter gave it to mom on a Sunday. Mom developed symptoms on Tuesday. That's perfect. That's very plausible. Even within 24 hours of exposure, symptoms can show up. And particularly if they were partying close together, sharing, laughing, maybe even singing happy birthday, blowing out candles, or, well, you say
Happy
this was Father's Day. If there was singing, if there was, if there was bar-like socializing, let's put it that way, that's the perfect storm for this. And if they hung out all day close together, very plausible that mom got it, mom got sick by Tuesday. Now, Dad, is the father positive?
Yes.
So the father is positive, but is not ill yet. Up to now, is that correct?
Exactly, yes. My husband actually spoke with him today. He came to work on Wednesday, and then I think that was his last day. Yeah. Okay,
so let's imagine, so the guy tested positive. We don't know when he got tested or whatever, but he is now 8 days away from the party. No, 7 days away from the party, and he's still healthy. That's pretty good.
Good for him.
That's actually a good sign that he might not get sick at all.
So he could be one of those asymptomatic people that's not spreading so bad.
Absolutely, he could be. Or he could get sick. Like if that guy makes it to next Sunday, he's not getting sick. Okay. If he makes it 14 days without active COVID illness, he's going to be somebody with antibodies who's a little bit protected. Lucky guy. Okay. Now understand that 50% of the people are going to have active symptoms within 5 days. Half. Okay. And you're a scientist yourself. You know that 5 days, picture a curve. It's not bell-shaped, but it goes way up fast. And then 50% of the area under the curve is from 5 days going back to 0. And then there's a super long tail that by the time you're out at 20 days, the chances are infinitesimally small.
Yeah.
So if this fellow makes it all the way to next Sunday with no illness, first of all, there's very little chance that he spread it to anybody if he stays fully asymptomatic, because those guys, it's really, we do know the pre-symptomatic people have the higher loads, but asymptomatic, it's more than we expected. So now here you are, you're kind of wondering, first of all, let me ask, how closely did your husband and this man work together?
Not closely. My husband's, away from him. Yeah. So this guy goes out on the job, and my husband is kind of managing the job.
Okay.
So this guy's coworker went ahead and got himself tested, doesn't know yet.
Okay, and that'll be interesting to see. Are they wearing masks at work, everybody?
They are, but they're not changing them out every hour or so.
Okay, well, I mean, I'm not so worried if it's every hour, but if how long is it going without masks? But if it's a casual contact between your husband and this guy, that's not how it's transmitting, okay? It's not.
I'm excited because they're not working together. It's not.
Yeah, I mean, that's not a scenario that I'd have much. I mean, look, we know nothing's a guarantee, but let's see what the coworker who just got tested looks like. Did your husband go for the test?
No, when he's not, what they're all going to be told. Like, we don't know if he's going to be sent home for 14 days or if he's got to get tested. It's his area. There's some outdoor work that happens with coworkers, and he's managing that. And so we're going to find out what the company's going to do.
Yeah, because most companies, the way it's working, like that happened to my brother. Where he worked with someone, he actually worked at a Target, and somebody that he was very casually working with got sick. And so the company paid for a test. He got tested, came back negative, but the people who were not closely working didn't have to quarantine. The people who worked closely with the sick person did. Okay. They did have to quarantine. Those in a more peripheral way did not. But they were all tested pretty quick. Okay. They all like Paul found out on Friday, and it happened to be Memorial Day. So he found out on Friday, the company said, we're going to tell you where to go. You tell us where you live. We'll give you the nearest testing center. We're picking up the cost. So he went in on Tuesday morning to get his test. But unfortunately, he didn't get it back till Friday. But they were telling the people who weren't in close proximity to where, like they were in different departments. They said, Paul, you can keep going on with your work. People closer to him were told to quarantine.
All right.
Cool. Thanks, Shelley.
So keep us posted, like unlucky events can happen, and if this guy really just got exposed on a Sunday, and, maybe he had mild contact with your husband Monday, Tuesday, Wednesday, a person who 7 days later is still not sick, I can't imagine a viral load that's enough to be contaminating, even with the This is just my professional judgment.
That's so good to know. The viral load thing is so nuanced,
viral load matters. Viral load does matter. Generally, and especially when both people are masked,
right?
There aren't that many aerosols, and if they're outdoors part of the time and they're not together, casual contact is not the spread. The 3 C's, even when you're working together: social distance, don't congregate, no, like someone was telling me a story, like there was a birthday party and there was no blowing out candles. They got one of those candle snuffer things. And so the person snuffed out her candles one by one instead of blowing them out. So, just like the thinking, windows open, best ventilation possible. As I told people, I now have a DC intern. He's living in my back room. I've bought HEPA filters for the air in both of our places where we are. Turns over the air in the room 5 times in an hour. We're not bringing people in. We're doing the best we can under the circumstances. I made a decision. I mean, I'm financially struggling. Not that I don't have a decent salary, but I made a lot of money with Airbnb, and that was enabling me to purchase a house that I now have to make a payment on every month, whether I like it or not, and whether there's COVID or not, right? So it's a balancing act, you know?
Yeah, that is so helpful. Thank you.
Thanks, Shelley. Okay, so let's see really here real quick.
Again, casual, super casual is not the primary route of spread. Not impossible. There are people we don't understand how they got it, but frequent and repeated close contact is the perfect storm.
Okay, so Marty and Jean both have questions, and there's another great piece of information from Brian Freitz. Marty asks, what about schools? Do you think they'll open, elementary and high schools? What is the risk, and do you think this can possibly work with our teachers and children infecting themselves? Can we talk about schools opening? How long is this going on for today? Marty?
Yeah, we're coming to an end.
1:30 is usually our end time.
I guess if we can finish everybody's question.
And Marty calls me Fokker face. And just so you know, if anyone read that, to get a little backstory on what
does
that
that
means, is that one of our favorite movies many, many years ago when we first met each other was Meet the Fockers.
Oh, I remember that. I do
It's
remember.
such a fun, there's actually two of them. There's a part 1 and 2. And then somehow she started calling me Fokker. So just a little background.
Wow, that is funny.
Do you want to address that?
Okay, I'm sorry. I was so busy laughing at Fockers that
It's really about schools and how we're going to manage
Oh,
that.
yeah. Okay, hold on.
Is this going to go on forever, Karen? Give us an end date on this coronavirus, please. The question made Karen leave.
If I could do that, I'd be rich. I just wanted to give you something, talking about Fockers. This is an Indian whiskey.
Oh, crazy.
I couldn't resist buying it just because of the name.
Is it the littlest bottle? Is that a tiny little bottle?
It's a tiny little bottle, it's just, you can buy them in all sizes, but hey, when you're buying it for the bottle, you don't want to get the big one, right? And look at it. It looks like I haven't drunk a bit of it. It's just so old, it's evaporating, but I just
that is so funny.
Yeah, schools. I noticed I noticed Shelley had more questions about, like, she's going to be around a newborn or something too. Shelley, see what happens with if you can get an antibody test, you might be able to get one of the blood draw types. If you have IgG antibodies, you're probably one of the safest people around a kid like that because you've got some level of immunity. But if you just have IgM antibodies, then you could be even pre-symptomatic. So that's a more complex thing, but just see what happens, just isolate. If you want to be around a newborn that's going to be born in another like 3 weeks, be really isolated. Make sure you don't get an exposure, and then you should be fine. Like, this is the whole idea. If you're negative and you don't get an exposure, you don't have any virus in you. It's just when you're interacting with a lot of different people, and like your husband, you're interacting with your husband and he interacted with coworkers, you'll always have some uncertainty there. And while it appears that babies are they're protected usually with maternal antibodies, they don't, nobody's got those for COVID, but that's an age group that doesn't seem to be getting sick. They don't have much of an immune system. And what hurts you in COVID is this hyperactive immune response. So surprisingly, the babies, I haven't even heard a case. I'll have to look for it. I haven't even seen a case of a baby in the literature, but I haven't looked, I haven't looked hard, but it's certainly not something we're hearing about.
Okay, we only have a few more minutes left. Do you want to address Marty's question about schools?
Yes, schools are no different than workplaces, right? It's the same thing we've been, talking about from all along, that you can reopen with these kinds of things, but here's the most critical thing for a school. What are you going to do when a child gets COVID or a teacher gets COVID? You got to quarantine the whole class, right? Because let's face it, that's how classes operate, you know? Everybody will have had frequent and repeated contact. I mean, if you can social distance, the older kids might be able to social distance a bit, but when somebody comes down sick, which is going to be inevitable, are you prepared to pivot to online classes for that group? What's going to happen? What I see as the hardest thing for schools that plan to open is what happens when you get somebody sick. What are you going to do then? Especially if there are vulnerable people in the mix, right?
You know, it sounds like, at least I know with my son's school, they're really preparing. They know that they're going to be doing some distance learning. They know that.
Yeah, because what I see a lot of schools doing is partial reopening, like you're not in school all day, you're partially online, because what if you think you're going straight back and you're back forever, I think that's living in a fantasy world, because what will you do when you find out that that school teacher is actively ill? It could be every kid in the class got an exposure, or it could be none. Every case is going to be unique.
So this is interesting. Just right now, literally, I got a text message from I don't know where this is from, COVID update. I don't even know where it's from, quite honestly, but it's a COVID update that I got. It says bars, wineries, nightclubs, and brew pubs in LA County must close immediately through the new governor's orders.
Smart move. He did the right thing.
Yep. So I don't know where that came from, but it just came to mind.
Not that you were going to go there anyways.
No, I'm not going there.
Yeah, you wouldn't be going there.
I'm definitely exercising a lot of caution. I mean, I'm seeing people in small, my aunt and uncle came for dinner last night. I had all the windows open, all the doors open. I even actually admonished Adrian, which, as a parent, you feel bad about. He did like and I was like, Adrian.
Yeah, Adrian, got to watch that.
You can't do that during COVID.
Got to watch that. COVID, certainly he did it.
I probably wasn't as gentle as I could have been. I was probably reactive.
Yeah, just remind. I mean, everybody needs a reminder. Buy yourself a HEPA filter, those air filters with a HEPA filter. Mm-hmm. I mean, you're doing the smart thing. I mean, I understand mental health matters.
Yeah, and then some of Adrian's friends came. We've got a pool, and it's got a ton. I'm not in charge of the pool, so it's got a ton of chlorine in it, which during the time of COVID, that's probably great. That would have been my first choice, but during COVID, awesome. So, him and a few friends swam last week, and then I made a meal for them, but we did it outside. They all sat outside and had the meal together. So, I'm sure they're probably a little too close to each other.
And by the way, pure water, COVID can't survive that either. Pure water would kill it. I mean, when we work with these in the lab, there's always buffers and everything. And I might share
I'm doing that kind of stuff, but I'm definitely, my mother was supposed to go to Florida on the 2nd, I believe. And I don't know what day that is, next week sometime. And, my brother started coming out with the stats at Florida. I mean, the numbers are.
Oh my God, they're very bad.
And, it's 84 and over. If you get it when you're 84 and over, 28% of people are dying.
Yeah, it's I thought it was higher than that.
I'm sorry. It's 38%.
Yeah.
84 and over 84, 38% of people are dying. 75 to 80, 28% of that age group, if they contract it, are dying.
Wow.
And it's significantly on the rise. And his, as much as his family is not as doing, they have teenagers. It's really hard to keep them under control.
Yeah, you can't. That can't be done.
But, we have other family that's been in Florida. I'm like, I don't really want to see them. Sorry if you're on. I'm just, we have to really put our good thinking on and decide how we want to protect ourselves and then protect our community. There was one last question. Okay, so So Jean asked quickly about masks. N95 mask. She's just talking about it. Reusing mask, wouldn't the virus be gone after 3 days in the mask?
Yeah, I mean, but generally speaking, they're gone faster than 3 days within the mask. But there are even ways of cleaning an N95 to reuse it. You can find those online. People are writing in about them.
And she says, would an N95 mask that I purchased at a hardware store function as other N95 masks?
I mean, I think they're not quite as good as the medical grade ones, but yeah, they're pretty darn good. You know, they're better than, you know, making a cloth mask out of an old t-shirt.
Yeah. And then Bev says, quick question.
And they're available now. N95s are not, you can even get them. You can get gloves now. You can get all kinds of stuff you couldn't a few months ago.
Yeah. So she's saying, we were with someone outdoors the other night who smoked a cigar in our presence. Thoughts?
Yeah, not great. You know, again, anything, one thing that is,
I'm thinking, I haven't smoked in a long time, but I used to smoke.
Yeah, but the heat, you know, again, like I said, we talked about air conditioning. The viruses don't like hot stuff, okay? Viruses don't do well in heat, but exhaling like that, and you're cooling that air as soon as it hits outside. I mean, that, you know, first of all, nobody should be doing that at all anymore. And secondly,
how do you feel about that, Karen?
You know, I wouldn't allow it around myself. If, you know, if you're outdoors and you're 6 feet away, fine. Not if you're right beside me. You know, I mean, if you're, you know, blow your smoke in the other direction, fine. You're breathing. I mean, people are exhaling around me. I can't stop them from breathing, but you know.
Yeah, it's extra exhale.
Yeah, it's okay, a little. It's kind of like blowing candles out.
Yeah. Speaking of which, I'm going to sneeze.
I'm going to share my screen with you because one thing I've never done, I've never shown you a picture of cells infected with coronavirus.
Oh, yeah.
I thought
there's a question from Sabette while you're getting that. She's asking, is there any information on those with autoimmune diseases being more or less or neutral and the reaction to the disease?
I don't think I haven't seen anything about that. And, you know, again, it really depends on the type of autoimmunity you've got, right? Because people with autoimmune diseases can have a hyper responsive pro-inflammatory response. Many of these people are on suppressants, okay? Like, you know, like the rheumatoid arthritis that take hydroxychloroquine. So I haven't seen anything in particular. These are people who definitely need to pay attention and to look specifically at the type of illness they have and what they're taking for it. Because you have to have some level of pro-inflammatory response to defeat a virus, period. If you don't have that, the virus will overrun you, you know, and, you know, nobody is that, unless you're like Bubble Boy, you had no immune system where anything could kill you. You know, it's impossible to really judge except on a case-by-case basis. But if you've got an autoimmune disease, you want to be more careful. So now let me just let our last note to see what it looks like. Here we go.
I'll read Brian's
and then you can read Brian's comment while we look at the virus.
Okay. Oh, can you tell us about what we're looking at?
Sure. This is actually a murine coronavirus. It's called murine hepatitis virus. Now, this green part is the uninfected part. These are the cells. These are astrocytes, so they're brain cells. The reason I studied this virus was as a model virus for multiple sclerosis. It did get into the brain. You know, it did cause encephalitis in the mice, but it mainly caused hepatitis. It was a gut virus. We injected it into the brains of the mice in order to study it. But notice something. Notice how you can tell these are discrete cells. They're individual cells. Over here where it's yellow, I was using a stain that stained the virus red and the cells green. So when we had this red and green overlap, it turned yellow. And wherever you see this, notice how everything is like, it looks like one giant cell. Like, wouldn't you say this almost looks like one giant cell with multiple nuclei?
Yeah.
That's what the virus does. It like, there's no immune system. This is in a petri dish. And so these cells, they would produce tons of virus, and these spike proteins would go out of one cell and into the next, and the membranes would fuse, and it would form what we call syncytia. So this is one nasty thing this virus does. Okay.
Wow.
And this is even, you know, it's a model virus. It doesn't infect humans, but it does have a spike glycoprotein. And that was the protein I was staining for here. And so all these cells were healthy cells like these guys. This is an advancing viral front about to get them. These guys are all dying. Okay, they're all in the process of dying. So I just thought, you know, I've never shared that. You know, I thought, why don't I just show some? We all see the cartoons, but those were real mouse cells being infected with a real mouse coronavirus.
Okay, I'm going to share Brian's thought here. This is about,
I think Brian should be running for office, frankly.
Laws of our country. Well, we can talk. Brian, are you there? Karen thinks you should run. Jacobson versus Massachusetts, heard by the Supreme Court in 1904, decided in 1905. The court held, in every well-ordered society charged with the duty of conserving the safety of its members, the rights of the individual in respect of his liberty may at times, under the pressure of great dangers, be subjected to such restraint, to be enforced by reasonable regulations as the safety of the general public shall demand. Further, real liberty for all could not exist under the operation of a principle which recognizes the right of each individual person to use his own, whether in respect to his person or his property, regardless of the injury that may be done to others. I'll share that in the follow-up.
Yeah.
We can
It's
take
so
a
interesting.
bite out of that.
Every society has a communal pole where the common good is there, and an individual. And again, that's a balancing act.
Yeah.
We don't want society to completely squash down the individual, but now we're having individuals completely trying to squash down society, and we're out of whack. So.
Well, Karen, thank you so much.
Okay. So,
And
yes,
so we will not be back next week. Next week is the July 4th week.
July 4th, yay!
We decided to do Independence Day in the US. We decided to do back-to-back this time. We won't be here next week, but then we will be here the week after next in 2 weeks.
Yeah, let's see what date that is so you can mark it on your calendars. I can't believe, can you guys believe we're out of June already almost? It's too crazy. So we will be back on Sunday, July 12th. Does that sound good to you?
Yep.
Okay. All right. Well, I want to say goodbye. It was lovely seeing everybody.
Thank you, everyone.
It's, you know, stay safe, and I hope you have a great, you know, coming 2 weeks. Bye.
Ooh.
Kristen,
we do have a question from Cheryl, but we'll have to save that one till next time.
Okay, let's, can we do it quick? If everybody wants to leave except Cheryl, can we try to just do it
okay,
quick?
we do real quick. Okay, thanks everybody.
Yeah, feel free to leave. We're just going to answer Cheryl.
Okay, so
quick.
Cheryl says, I'm curious to know what your opinion is about getting an overdue dental cleaning. I have one too. I would prefer not to do it, but since I live in New York City East and close to the Nassau County border, my feeling is that this may be a time with the lowest COVID for some time.
Yeah, New York is a place I probably feel safer. And what dentists are doing, they have this system where they're trying to suck aerosols. You know, these guys got on this fast. They suffered with HIV. So one of the safer procedures to have, I mean, you know, they have this thing where, you know, they're sucking aerosols down into a tube. To be honest, it's far riskier for them than for you. So they're trying to protect themselves from you, and they see a lot more people. Personally, I'll tell you, where I am in DC, I'm not doing that. Like I actually had a temporary cap put on in February, and I was supposed to get my permanent cap in March. It was rescheduled to last week, and I canceled it, and I'm still canceling. I'm not I'm not going in for that yet, but New York is green right now, isn't it? So understand that when you go for this, the people that are most at risk are the dental professionals. And they most, as far as I've been hearing and seeing, they're going crazy to protect you. Now, if it's just cleaning, is there something you really want to do that you feel you need this cleaning to be professionally done rather than you just, putting extra care into your own home cleaning? So those are the questions. And you're thinking, I want to get in now when the cases are low because it's going to go higher and I don't want to push my cleaning off a year. Well, again, this is your balancing. New York is in green and it's gone low, and it's probably it might turn around. There might be a second wave in New York, and then you've missed the window. So again, your call.
Marty's saying, are they limiting the number of patients?
They are very good about this. Of course, they're limiting the number of patients.
Yeah, that's what I've gotten from my office.
They're having those plexiglass masks, and they're also sucking aerosols. As I said, who do you get exposed to in a dentist's office? They don't keep people, there's no waiting room anymore, okay? You're being called in, they're staggering people. You're not going to see another patient. You're going to see a dentist and a dental hygienist, and they're going to be protecting. They're going to be double protected with a mask and a plexiglass thing, and then they're going to be trying to suck out aerosols. And they have generally very good ventilation from the get-go because it's a dentist's office, right? So. And they may have even put HEPA filters into the individual rooms. You can call and find out from your dentist what specific precautions they're taking, but I'm more worried about the dental professionals than the patrons of the dental clinic. I just don't want to get on the metro. To me, I'm more worried about physically getting there because I can't walk. It's just, I don't want to spend forever walking, but that might be what it comes down to.
Karen, just because Marty's asking too, what about the regular doctor? In fact, I was thinking about it usually with Adrian every year around his birthday, I get his yearly checkup. And I didn't do it this year. I completely forgot. And then I was like, oh my lands, I haven't done that yet. What about that kind of doctor?
Yeah, and if there's no real issue, people are doing tele-checkup, because look, they don't do very much when they do these things, right?
No.
And if you've got lab tests that need to be done, those aren't done generally in the doctor's office these days anyhow. And then you have to schedule an appointment. Again, I have a list of labs I want to get done, and I've been putting stuff off. I put stuff off that's actually much more critical than just a regular checkup. And again, I've made a decision that the putting off, what's going to be the worst case scenario in putting off versus a worst case scenario in catching COVID. These are the calculations I'm doing. And I am an older person myself. So I've even held off getting my labs. But I think in DC's trending down. When DC turns green, I might go just make my appointment at LabCorp, and I will not be encountering people in the waiting room. I'll be fully masked. They won't even let me in. I'll be let in. I'll have to be in a certain place, and I'll get my blood drawn, and then I'm out of there.
And Marty says she's talking specifically about her mom, who's 93, and she needs a checkup on her eye. Her eye needs to be seen. Anyway, I actually went to the optometrist last week. I go to the optometrist at Costco. I hadn't had an eye appointment in 7 years, and I was like,
well, maybe it's time to get your prescription, right?
So I actually went, and what they did was amazing. Typically when they're really close and your chin is on the machine, when they usually tell you, look this way, look that way. He didn't do any talking. He had a shield on. I had my mask on. Mm-hmm. They really cleaned everything thoroughly. Probably should have gone first appointment in the morning.
Yeah, always go the first get the earliest you can, because then,
But he just did this. He was doing signaling with his fingers instead of talking.
Why not?
I felt like it was really, they did a lot of health checks. They did a lot of questionnaires. It was really incredibly thorough. So I felt
And they're
good
going to
about-
take your temperature with those.
They took my temperature.
Guns and stuff. I mean, they know, these guys are all over it. They know what they're doing.
Yeah.
I'm more worried about the trajectory. For me, I'm more worried about the trajectory to the place. I don't have a car, right? So I'm on the metro. A bus I wouldn't even get into right now. I would be more likely to get into the metro. Number one, it's faster, it's less crowded, right? And there's good ventilation because it's underground, right? Whereas the buses, they're air conditioned, windows are closed, and often it's packed wall to wall people who aren't all masked.
Yep.
So, but
All
yeah,
right,
go
guys,
for the first, early in the morning. There hasn't been a time to build up, right? It's like, let all the virus deactivate overnight and then go in, if there even is any, and they'll be doing extra cleaning.
Right.
But hey, Kristen, I'm going to call you. Are you free right after this?
You can call me.
I'm going to call you. Okay.
Thanks,
everybody. And
Bye.
bye-bye.